Propeller is mostly known for these connected devices and saying, hey, we connect inhalers. But there's a lot more to this than meets the eye. So for us, we have actually created a couple of different types of experiences for the patient. First and foremost, we've created both an app experience where they can engage on the app, be able to monitor their use, look at their controllers and their rescue inhalers. But most importantly, for patients who are not app users, we've created an entirely appless experience that allows us to put a hub in the wall, and these devices still connect completely passively to that, and sends a signal either to a caregiver, like a mom or a dad for an asthma patient, or for a son or a daughter or a caregiver for an older patient who's struggling with COPD. And what we're able to do is send that information to the healthcare providers as well. So you're a clinician. Now you can see which patients are the most urgent to take care of. That can simplify a lot of the workflow within a provider's office and get their time and energy focused on the highest risk patients. So, but most importantly, a lot of solutions like ours, they don't really always deliver value to all the stakeholders. And that's the magic behind Propeller. We figured out how to create adherence and persistence, which creates value to the patient and to the pharmaceutical companies that we work with. We've managed to create reduction in utilization, which helps claims. We've managed to work with clinicians to create better outcomes. And with patients, we've managed to create better quality of life and the burden and lift that burden of the disease, both financially and from an experience perspective. So where does all this kind of wrap up? It really comes down to what are we able to save on a cost basis to create value? For us in a commercial COPD population, we can save $2,400 per patient. For our Medicare population, we can save over $900 a patient. Obviously, much more complexity in taking care of Medicare patients, and many of them have a lot of comorbidities. But this can make a huge difference because if you can't breathe, a lot of other problems are much more difficult to overcome.